Namaskar, I am Dr. Nikhil Modi, Senior Consultant, Respiratory, Critical Care, Sleep Medicine, Indraprastha Apollo Hospital, Delhi.
Sir, how is asthma different in older patients?
See, as we all know, asthma is a type of allergic problem of the airways. So, as soon as we are exposed to allergens in our atmosphere, we have breathing issues. Now, if we talk about elderly population, so with the constant exposure to pollution with time, and also they acquire many other disease with age. So, due to that, asthma severity can be very high. Also, the response to the treatment may be different because asthma COPD overlap due to the air pollution, sometimes smoking. The asthma which is very responsive to the medicine may not be that responsive. So, the overlap which is there can lead to increase in medicine requirement. Further, other disease can complicate the things. So, that is why we have to take in consideration everything around and then treat the asthma in elderly.
Can my asthma be controlled easily? Are inhalers safe?
Yes, asthma is nowadays easily controlled. The medicines which we have right now in form of inhalers are very good, very effective, and if we take it regularly as per our doctor's instructions, then our treatment will be good and our symptoms will be totally controlled. Talking about the inhalers, inhalers are the mainstay of treatment and they are the safest option of medication right now for asthma. Why? Because inhalers have medicines in dose of almost as less as micrograms. So, in a very low dose, when we inhale them, it directly goes where it is required. So, a very local effect is produced. So, there are almost no side effects, and due to it going locally where it is required, the symptomatic control of the disease is best. So, inhalers are the safest option and you should not be worried about it and take it regularly as and when needed.
Hello doctor, I am an athlete and from the last few days I have been having some increased breathing rates while I am resting. So is this a sign of asthma?
See, increased breathing rate may not always be asthma. You have been an athlete throughout your life. Sometimes when you stop practicing about that, breathing rate can go up due to that. Sometimes if you have some infection, breathing rate might be high due to that. So, to label it as asthma, we need to understand other associated symptoms. A high breathing rate with a breathing issue and a wheezing sound or a whistling sound coming from your chest, some cough, increase in these symptoms with either season change or exposure to dust, smoke are the common symptoms which may be associated with it. So, once we see them, evaluate them and then obviously do some examination with you, then only we can say whether it is asthma or something else.
Is there any exercise that can help me reduce my asthmatic symptoms?
See, mostly if you are an asthmatic, exercise sometimes can increase your asthma symptoms also. We call it as exercise induced asthma. So, you firstly need to be sure whether exercise is not increasing your symptoms, and if it is, then first take the inhaler before doing exercise. After that you can safely do the exercise. But if you are overweight, you have other issues, then reducing weight with any form of exercise will control your asthma. And also some deep breathing exercises, even yoga and some amount of meditation which can relieve stress have been seen to contribute to control of asthma. So, you can do all these things right now.
How can I reduce asthma triggers at home?
See, there can be multiple of asthma triggers which can be there at home. If we talk about dust mites are the most common thing. Indoor air pollution, we always talk about air pollution outside, but we do not realize that this air, once it reaches inside our home, is similarly polluted and it can also cause this problem. So, reducing this air pollution again will help. Thirdly, using combustible things like wood, sometimes we use it for warming our hands in winters and all, These all can also lead to trigger of asthma. Most common other things which can cause asthma are the pollens, which are there because of the flowers. So there are hundreds of flowers and hundreds of pollen around, so it's very difficult to control them. But obviously if you find something which is causing increased symptoms for asthma, take that flowers, take that plants out, plant some other thing which may not be producing that much of pollen. And apart from that, even your pets, the pet dander, the cat and dog, that can be a trigger for asthma. And if you have an asthmatic who once in close proximity to your pets is having a problem, then taking away the pets is going to help. So these are the common things which we can do at home to minimize the exposure to all those things which can lead to attack of asthma.
What does the asthma diagnosis mean for my child?
See, asthma diagnosis doesn't mean that he is in a life-threatening stage. Asthma is a simple allergic disorder. Minimizing exposure to all those allergens can reduce the asthma. Further, we have so many good medicines in form of inhalers and other supportive medicines with which asthma can easily be controlled. So you need not worry. Your child is still safe. Only thing is you should ensure is that he takes medicine on time and you have a regular follow up with your doctor. With this, it is just like any other disease which can easily be controlled and the child can have a healthy normal life further. Hello friends. So today we had a discussion about managing asthma, especially in different age groups, how a child, an elderly, an athlete have different symptoms and how can they manage their asthma. So please be safe, stay healthy and keep yourself informed about all the developments and talk to our doctor whenever you need it. Thank you.